in any hospital now, there is typically an emergency room plus or minus several ICUs where they house patients for these complex problems. There's life-threatening infections called sepsis and septic shock. And what they found is that there's direct mortality increase from delaying antibiotic therapy. And so it's somewhere in the range of 7, 8, 10% increase in mortality for every hour of antibiotic delay. And so as a pharmacist in the ER and the ICU, I can help be there to make sure that the right antibiotic is chosen as quickly as possible at the right dose, the right frequency, to help decrease the amount of time delay in between recognizing this life-threatening infection and receiving the actual antibiotic that will save them. So the key players in a medical team are your physicians, your nurses, your pharmacist, as well as any therapist you may need. A patient that comes in for an infection, the acuity of the patients is life-threatening. There's 60 different antibiotics to choose from. It's going to be much more difficult for the team to decide the best therapy for this particular patient. And so having a pharmacist there who has a specialty in critical care, we spent an extensive amount of time learning everything there is about these drugs and how they're going to interact with this specific patient. And with the specific disease state that's causing their visit, we can help optimize that therapy and pick the right one at the right time, at the right dose for this specific person. Without us, the medical team is missing a key component to improve patient outcomes. They have a better chance of surviving, a better chance of recovery, a better chance of getting out of the ICU and going home with us there. So there's sort of three big components to being a critical care pharmacist that set it apart from other pharmacy practices. You have a lot of interaction with the medical team. You have a lot of high acuity, high adrenaline situations. And the third thing is the complexity of the disease states. To become a critical care pharmacist, most people have to pursue postgraduate training, so it takes an additional 2 years of residency. As an integral member of the medical team, I'm there to act as the drug resource or the drug expert for any questions anyone may have. And so having a direct role on helping them get through this life-threatening this scenario is extremely rewarding.